Cheryl, I cannot hear you.
Oh, well, hello. Thank you.
There, thank you.
Oh my gosh, I was talking away. I'll start over. So welcome to everyone to our current topics in autism lecture series. Today is Autism, Aggression, and Safety, Strategies and Interventions, Part 2. For those of you unfamiliar with this lecture series, we did do a series of these topics earlier this year. One of them was Autism, Aggression, and Safety, Part 1. I would encourage those of you who missed that or are interested to go to the Autism Society San Diego YouTube site where that is available for free. So again, we want to welcome all of you. Just a quick few announcements here at the beginning. If you have questions, please put them in the chat. We will allow time at the end of the lecture to address your questions and comments. And again, thanks for joining us. This lecture series is presented in collaboration between SmartCare Behavioral Health Consultation Services. We are a program of the Vista Hill Foundation and the Autism Society of San Diego. SmartCare Behavioral Consultation Services is who I work for. My name is Shirley Fett. I am a family nurse practitioner. I'm also a pediatric mental health specialist. And I'm going to turn it over to my colleague, Alyssa, and she can introduce herself and share just a brief description of what we do.
Thank you, Shirley. Again, everybody, welcome. We're so happy to have you here and participating. My name is Alyssa Label, and I am the program manager for the SmartCare Behavioral Health Consultation Services. We call it BHCS for short. And the purpose of our program is to support families within San Diego County in getting access to mental health care. So we support their primary care doctors as well as the families directly themselves. And part of what we do is also to put together.
Oop, Alyssa's frozen. Is she frozen for all of you?
Yes.
Okay, we'll go on until she can get back on. Alyssa, you were frozen for a large portion of that. So I just went on. So again, and then the other organization that we are affiliated with and is co-sponsoring this is the Autism Society of San Diego. The mission is to improve the lives of all affected by autism. If you're interested in learning more about that organization, the website is listed here, as well as an email and phone number of how to contact them. I am a volunteer board member as well with the Autism Society of San Diego. My specific area of interest in autism is because I am the mother of two adult sons who are now 28 and 30 years old. In today's language, they would be considered level 3 autism with intellectual delay. They live with my husband and I. So not only do I work in this field now professionally, but I've lived the life, as we like to say, and I still live this life. So I have a real world experience as well as professional background in the area. And I'm really dedicated to helping all of you who are here today, professionals, family members, community members, learning more about how to really help individuals on the autism spectrum have a great quality of life here and wherever you're living, actually. And I'm going to let Alyssa elaborate a little bit more. Unfortunately, like I said, you were frozen, so I'll let her share a little bit more about herself as well.
Thank you, Shirley. Sorry about that, guys. So I'm not sure how much you heard, but I'm the program manager for SmartCare Behavioral Consultation Services, and we work with primary care doctors in being able to support families throughout San Diego County get access to different services in the community. And we also put together training series to support the community as well, like this series. I am also a board member of the Autism Society of San Diego. Autism is near and dear to my heart because I have several family members. So I have also lived the life and also lived the professional life. So I'm really excited that we have such a unique training series put together and hope that everybody finds it helpful.
Thank you, Alyssa. So I'd like to start today with this quote. Thinking of your child, and that child could be small, teenage, or adult, as behaving badly disposes you to think of punishment. Thinking of your child as struggling to handle something difficult encourages you to help them through their distress. So I think that's a helpful lens to always think about challenging behavior and aggression, and that are they purposely behaving badly, or are they really struggling to handle something? And that's how it's coming out, that's how they're communicating with us. So what is severe behavior? I thought it was good to just talk about a framework for what we would consider in mental health. What's a severe behavior? It's any behavior that harms or hurts the individual, also known as SIB, self-injurious behavior, or behavior that harms or hurts others. It's a behavior that keeps a person from accessing activities of life. It could prevent them from eating properly, sleeping properly, participating in activities like school, play, family activities, work, and community. I think this is really important for all of you to consider. It's not just the overt aggression, but is the behavior really limiting their ability to access life? And it's also behaviors that decrease the ability for others to care for them. Okay, so there's lots of maybe challenging or odd or other behaviors that are part of autism, but when we're talking about things that we really need to intervene or try to address, think about these questions. Is it harming or hurting the individual or others? Is it keeping them from accessing their life? Is it also preventing others from being able to assist or care for them? Then that would fall into what we would consider severe. What are some examples of mild, moderate, severe behavior? I suspect many of you on this call lecture today could list many more. This is by no means all inclusive, but some examples. One could be eating a very restrictive diet leading to health issues. So again, that's not necessarily aggression, but it can be really problematic and it needs to be addressed. So that could be a severe behavior. Obviously, screaming, throwing objects, hitting, threatening to harm others. I'm going to stab you. I'm going to kill you. Taking clothes off in public. I can just share with you, I used to joke with my second son, who's 28 now. I used to say, oh, he's a clothing optionals guy. I think it's a sensory issue. Many of you have had the experience where your kids don't want to wear clothes. So, clearly if that doesn't get addressed and they're taking clothes off in public, that's going to severely restrict where they can go, including school, family get-togethers, and so on. Jumping into neighbors' pools. I have a parent friend of mine whose son's similar age to mine, and he was an eloper and he would always want to run and jump in their neighbor's pool. So for two things: one, it's trespassing and your neighbors are going to be freaked out, and two, what if your kid doesn't know how to swim? That's a problem. So entering people's homes, same thing. Rubbing your hands, biting knuckles repeatedly, leading to skin breakdown. This is a self-injurious behavior, kind of that repetitive motion type of thing. And head banging or head hitting is also fairly common, and that's a self-injurious behavior, and we consider that a serious behavior. So again, examples, by no means all inclusive. Let's talk a little bit about what self-injurious behaviors are and what they look like. In all honesty, 50%, and this is research-based, 50% of autism spectrum disability adults will engage in self-injurious behavior at some point. So ASD individuals, 50% of them. So I often think about serious behavior and aggression, and it's not something that people tend to talk about. I've been to many support groups myself, many conversations with people over the years, and when you think about it, 50% of individuals will have self-injurious or severe behaviors. Why aren't we talking about this more? And I think it is an elephant in the room, and I'm hoping after today you'll come away feeling like it's okay to talk about it, it's okay to ask about it. We are not berating the person that we care for or love, but we're trying to help them by really candidly addressing this. Individuals that are more prone to self-injurious behaviors are individuals with autism who do have an intellectual delay. Tends to occur more frequently in younger children. Individuals who have a lower level or lower capacity to communicate their needs, again, limited verbal or nonverbal, and don't have a communication device. Impulsivity is also a predictor of self-injurious behavior. Individuals who are very, very rigid and insistence on routine, also at risk for this. Regression, and if there's medical issues in conjunction with autism, if the individual has gastrointestinal issues, what if they have eczema and their skin's itchy all the time? They're going to be more prone to just being repetitive and having more self-injurious behaviors. So these are all things to take into consideration. So again, what are the risk factors for aggression and severe behavior? This does not mean every person who has these challenges will develop aggression and severe behavior, but certainly if they're present, we need to be mindful that it could happen. Again, communication challenges, individuals who cannot articulate their needs, express themselves, and don't have any tools for doing so. Individuals who are very, very STEMmy in autism language, individuals who have a lot of stereotypical repetitive behaviors, they tend to be a little more prone to be aggressive because if they're doing their STEM activity and then we say, hey, you got to come over here and start doing XYZ, or we need to leave and go get in the car. That stemming is such a need and desire for so many kids that it's hard to break it, and they can get aggressive when we try and modify that. Ritualized sameness behaviors, same idea, and sensory issues. Kids that are very, very, and adults that have a lot of sensory defensiveness or sensory sensitivity are going to be more prone to aggression and challenging behaviors. So does severe behavior interfere with quality of life? And the answer, I hope you understand, is absolutely. Yes, it limits their safety and it limits access to everything. That is not a hyperbole. If we do not address why this person is having aggressive or challenging behaviors, and they're 3, 4, 5 years old, and we go, okay, we can just scoop them up and carry them out of the store, or their hitting and their biting isn't as difficult to manage, and fast forward 10 years, 15 years, and this has not been addressed, the doors will close. Service providers cannot and will not work with somebody who's 18 and 250 pounds, who's hitting and biting and throwing things. So it absolutely affects the quality of life, and it is a responsibility for all of us to really help this person and figure out why is this happening and what can we do to help them so they don't feel they have to communicate with us in this way. It will limit access to everything if the aggression is not properly addressed. So what are those impacts? Again, how does it impact the family? It's physically harmful. Again, things parents and caregivers don't want to talk about, but they'll have bite marks on them and bruises and black eyes. And so physical harm is real. It creates stress, anxiety, and depression within the family unit, creates isolation, reduced social support and connection. If your child, adult is aggressive, taking off their clothes, biting, hitting, they are not going to get invited to birthday parties. They're not going to be able to make it on the playground with the other kids at school. And as adults, it becomes a huge problem because you can't have an adult assaulting other people, right? So it's very, very isolating if this behavior continues. And it creates financial burdens, things we don't really always think about. But if you've got a particularly aggressive child and you have limited resources, the school's calling you every day, you got to come pick up your kid and bring them home, even though they're not supposed to do that. They do because they're having an outburst or a tantrum. They elope. Usually one parent has to quit their job or cut down on their hours. So right there, that's a financial burden, isn't it? So things like that, co-pays for insurances, hospitalizations, the cost for that. So there is a financial burden with challenging behaviors. And then, of course, what's the impact on teachers, staff, caregivers? Again, physical harm and safety, stress and burnout, and high turnover rate, which I know many of us that have been the recipient of services know that there's a high burnout and turnover rate in individuals who work with this population. I think the most important thing that we need to talk about today is what are the consequences for the individual with autism if we don't deal with this, if we don't figure this out and help them. They have less engagement and learning opportunities, fewer positive social experiences, less participation in the community. There is a higher need for psychotropic medications, more likely to need psychiatric hospitalizations and residential placements. Placement in restrictive classrooms and residential settings. Again, we understand that you have an individual who's biting, hitting, kicking, and potentially injuring themselves and others. We can't just let them have free range in the community and in these environments. And that's the consequence of aggressive behavior that is not addressed. Individuals that are aggressive are more likely to experience some physical interventions. We talked about this last night, Melissa and I, as we were preparing for the lecture, and about PERT, Psychiatric Emergency Response Team, which is the law enforcement response. Just so you know, if you call PERT for an aggressive behavior and it is determined that this individual needs to be transported to the hospital, wherever, they will be handcuffed. Even if it's a 6-year-old, they will be handcuffed. I don't know if a lot of you know that, and I'm not saying that's not a reason to call if you're in a life-threatening situation with this individual. You got to do what you got to do. But to this point, more likely to experience physical interventions when the behavior is occurring, depending on who is involved in the event. And they have a poor long-term outcome for all the reasons we've already mentioned, because they are in these restrictive environments. They don't get an opportunity to be in the community. They have less engagement for social and learning opportunities. So all of these are really good reasons why we, as people in their lives, need to really, really tackle this and figure it out. So let's start with us first, us being parents, caregivers, siblings, teachers, therapists, how you can help a special needs parent. Special needs families often need help, even if they aren't asking. And I like this because it's from an autism dad. So ask, if the kid has bruises on him, if mom and dad come in and they seem frazzled, just saying, how is it going? Don't be afraid to ask. Parents, and I can speak to this from my own experience, we don't want to talk poorly about our children, right? We don't want to say bad things about them. And also, I think some parents think it's a reflection of their skill set and their parenting, and it's not any of those things. Nobody thinks you're a bad parent. Nobody thinks you're not taking proper care of your child or even talking badly about your child. But for all the reasons I've already outlined, you have to talk about this and get the help you need to deal with it. Briefly, what can we do? And I said earlier at the beginning, we do have part 1 of this lecture series on the Autism Society San Diego YouTube channel, and then we go into great detail about what to do in the moment when the actual event is occurring. And I real quickly summarize that on the left, but again, this is available on that YouTube recording for you. Stay calm, limit what you say, move the person and yourself to a safe place. And as I said, refer to part 1 for more detailed strategies on what to do in the moment for an aggressive behavior. And then on the right, consider your own physical and emotional capacity. Do not be afraid to seek help for yourself, okay? I'm going to let Alyssa talk just for a moment about trauma and how this fits into a bit about what we're talking about today.
Absolutely. There's definitely a correlation that can happen between trauma and the likelihood of seeing some more aggressive or just more intense behaviors from a child or an adult. The effects of trauma, once a kid has been traumatized, and when it comes to traumatic events, we're not saying that, a kid has to be in a severely violent or anything situation. A trauma could be losing a pet, losing a grandparent, parents getting divorced. So it's just not necessarily something that you need to shoulder blame just because your kid's been a little traumatized. I just want to put that out there. But effects of trauma can be physical. You can have some physical sensations such as tension, numbing sensations, heart palpitations, restlessness, feeling on edge, feeling dizzy, feeling tired. A person might become more hypervigilant, more aware of their surroundings, always feeling like there's some danger lurking around the corner. Excessive worries, anxiety might be heightened. You might see, particularly a kid with autism might be more perseverating more on the things that worry them or concern them. So you might see some things like that heighten up. And then, some real common feelings are to have fear, panic, over just small things that might not seem reasonable to you. But because this kid's experienced a trauma, they're just more hyper focused on that. There could be some sleep problems, difficulty falling and staying asleep. Even sometimes there can be over sleep, having some pretty intense dreams or nightmares. In some extreme cases, there could be some dissociation where things just don't feel real. The world doesn't feel real around them. And definite some heightened sensitivity, which is always important whenever we're, working with our individuals who have autism, where, the world's already a sensitive place for them. So having heightened sensitivity can be distressing. And then, of course, there's some medical symptoms that can pop up with stomach aches and some things that can happen with more long-term effects. And one of the reasons why we did want to mention it here is just because if, we do have some trauma on board, there's going to be a lower threshold of things that will set them off that might escalate to aggressive behaviors. Because there's a thing that happens that's called trigger stacking, where you have multiple triggers happen, and then you're more likely to hit that aggressive behavior. So it's just important to take note of that, to understand, if your kiddo does have some trauma on board, or someone who has some trauma on board, one, let's do our best to make the world a little bit more relaxed and gentle place, knowing that that threshold could be a little smaller than it would be for the average bear.
Thank you, Alyssa. And I would also add being mindful of your own trauma as the caregiver and as the parent, not just the individual with autism. I think we as parents, caregivers, if we've been assaulted by someone, again, not blaming them, but it can be traumatizing for you, and recognizing you yourself may also be experiencing some of these things. And that's where I think it's important to acknowledge it and get help to process through. I'm going to tell you just a really funny it's not really trauma, but it is kind of story. My oldest son is very, very fixated on all of his electronics. No surprise, right? Computers and all of that. And we had a voluntary SDG&E power outage that was coming on. So we knew it was coming. And so I front-loaded him, prepared him, tried to make arrangements for that. And this was last year, you guys. And he still, every single day, comes to me and wants to be reassured that the power is not going to be turned off at 10 o'clock. So it was traumatizing for him. And he just has this hypervigilance about the power going off now. So again, traumas don't have to be, as Alyssa said, some huge catastrophic event. But that was very, very impactful for him and very much worried him. So I'm always reassuring him and writing it down and making sure, but it's a daily thing he asks me about now. So just kind of a fun little interesting story, if I will. So how do we begin to treat something, a person, help a person who's having a lot of aggressive behaviors? And treatment planning is very important. It should begin with careful assessment. I'm going to talk in just a moment about what kinds of assessments can be useful for this, with key considerations to safety, the nature, severity, frequency, and duration of the aggression, and other possible contributors. We've already touched a bit on a few of those. And then the treatment approach needs to be comprehensive, coordinated, and family-centered. It needs to include both behavioral and psychosocial interventions. And there also is a consideration of pharmacologic treatment options, which would be medication. So we look at all of these things when we're trying to figure out what we're going to do and how we're going to do it. So the first step is to find out the cause of the behavior or behaviors. Challenging behavior is often, but not always, a reaction to the environment that services or people create around the individual. So think about that. It's a reaction to the environment that the services or people create around the individual. We've got to take some ownership of this and figure out what's my part in this, what are we doing, what am I doing that may be contributing to this person having a hard time. It could be noise, light, smells, or other sensory input. And there could be psychosocial contributions. We think about this, by the way, not just in kids with autism, but typical kids and typical adults as well. What else is going on in this person's world that could be stressing them out, dysregulating them, making them feel unsettled? It could be divorce. It could be other family members living in the home, which is not at all unusual with COVID, right? There's been a lot of changes in people's home dynamics. That could be dysregulating and upsetting for the person, and they can't really tell you that, but that's what it is. Parental mental health. Again, if we're having a hard time, if we are having substance abuse issues, if we're anxious, if we've got our own trauma that hasn't been dealt with, that can be part of the equation that we need to address. Real life living in an apartment with maybe living with multiple families, financial issues. I can't tell you how many times I get comments and questions about people that are living in an upstairs apartment and their child with autism likes to jump or bounce up and down all day, and they're risk getting kicked out of their apartment. That's stressful. So the parent's always saying, don't do that, but the kid really needs it for their sensory input, right? So those are real world situations. Psychosocial health insurance, not being able to access services or get what you need. And if there's abuse and neglect, both of the child, of the adult, and going on in the household in general. So these are all important things to assess. So what are some ways that we begin to evaluate, why is this person trying to communicate in an aggressive manner? Why is this person always wanting to take their clothes off? Why is this person always wanting to elope? One of the tools that is very helpful is to try and keep a log of the behaviors, and that can be requested of the parent, the caregiver, and the school. Information that would be important to include would be things such as, what time of day did this happen? What was the setting? And what was the actual behavior? Was it hitting? Was it biting? Was it running away? Was it screaming? And documenting that. The goal would be that all of this data would be brought together and could be analyzed to see if there was a pattern, a consistent situation, environment that seemed to be contributing. Professionally, you can request a functional behavioral assessment. This is done by professionals to try to understand the function of the behaviors. It's done by direct observations in natural settings. The goal is to try and understand what is being communicated with behavior. So again, this is someone with a skilled eye who can really stand back and look at everything going on and sort of try and put it together. My second son had a lot of self-injurious behavior. He would take his fist and pound his head to the point where he had like a permanent dark spot where he had a bruise. We did so many assessments, behavioral interventions, on and on and on for many, many years. And I did get a behavioral consultant to come out, and he started doing this yelling thing with it. And what she came away with after all these years, and this was not that long ago, she came back and she said, you know, what I think is happening is nobody's telling him what's going on or what's going on next. He's my more nonverbal child. And I thought, wow, what a mistake on my part. And it's gotten so much better because now we are talking to him and giving him a written schedule and saying, okay, this is what we're going to do next. This is where we're going. This is the schedule for today. That significantly has reduced his self-injurious and screaming behaviors. So I'm here to tell you, even if you've been doing this a long time, don't be afraid to ask for help, because it really can be helpful to have an objective outsider come in and reassess the situation. Aggression may also be evaluated by other collateral testings, maybe looking for other psychiatric diagnoses, mental health diagnoses such as ADHD, learning disabilities, apraxia, and so on. You could also ask for testing through occupational therapy to really assess the sensory situation that the person's undergoing. So there could be other testing that could be really helpful in evaluating. And again, consider underlying problems such as sleep issues, medical issues, sensory issues, and more. Kids and adults often don't like tags in the collar of their shirt. If somebody doesn't know that and they put a new shirt on and they got this scratchy tag on their neck, they could act out. And if they're nonverbal, that could be the contributing factor. So again, it could be something as simple as that. All of these types of evaluations will help determine what is causing a behavior and hopefully how to address it. This is in the part 1 lecture series, but I thought it was helpful to just review it. This is a quick, really, I like this visual of what does a person, not just an autistic person, but all of us, frankly, go through when we're getting dysregulated and we're getting upset. On the far left is the time when we're calm, we're rested, everything's going well. We call those the teachable moments. That's when the time occurs when the individual on the spectrum is able to absorb information, take instruction, be engaged in whatever is going on. Then there's this phase called rumbling, and rumbling looks different for everybody. This could be a person with autism getting up and starting to run around the room. They could be making vocalizations. They could be starting to flip their hair, making clicking noises, any ripping up paper. It's going to be really important, and this is one of the things that the functional behavioral assessment and everybody else should be looking at, is what was preceding them having their blow up, their tantrum. I think it's interesting when we get a lot of feedback and people say it just happens out of nowhere. They're fine and then they're not. I challenge all of you to go back and really observe and analyze what's going on preceding that. And I bet you'll start to see that there were clues that this person was rumbling and that they were getting dysregulated and they were getting upset. Now, it may not be 15, 20, 30 minutes long. It may only be a minute or two, but I'm going to say there's always a rumble, and then the blow up happens, and then the rage occurs, which again looks different for many people. And then there's a recovery phase. So today, we're not talking about what our interventions are necessarily during rumbling rage and recovery. That was part one. Today's focus is really about what can we do to prevent them from even getting to the rumble rage stage. And so I do encourage those of you that are interested in more detail. We did talk about that in our prior lecture, but I wanted to review that just so you understood sort of the cycle of behavior. So what are the options? Number one, as mentioned, make sure it's not a medical condition. Number two, make sure there's a solid psychiatric evaluation to rule out or rule in comorbidities. Comorbidities meaning autism and ADHD, autism and depression and anxiety, autism and any number of other mental health issues. So I think a skilled psychiatrist could help determine, evaluate for that. Optimize behavior therapies, language, and educational programs. There has been a large contingent of us that have decided to homeschool our kids. COVID certainly mandated that for a lot of us. And then there's a lot of people that are choosing to continue homeschooling, which is fine. But in the context of that, make sure you're accessing all the therapies, language, and educational programs that are available to your child, even in that context. Ask. And the best way I've learned about all these things is going to support groups, meeting with other parents, and asking questions about what's out there. Optimize communication strategies. Nonverbal doesn't mean you don't have anything to say. And if you don't give somebody a tool with how to say it, what are they going to do? They're going to get upset, they're going to agitate it, and they're going to act out. So we need to have solid speech therapy, solid communication evaluations, and provide the person with tools that they can communicate to you so they don't feel like they have to blow up. If somebody said to you all day, don't talk, and you can't say anything, and you can't ask to go to the bathroom, and you can't say, I'm hungry, I have a headache, I'm tired, eventually you're going to get pretty darn frustrated and pretty mad about that because it's like nobody is able to help me, and then you're going to blow up. So think about it in that way. Optimizing social skills and social cognitive strategies for the person. This is being proactive instead of reactive. Getting all these things in place for the individual so that they don't feel they have to act out. Psychotherapy can be very helpful, particularly for individuals who are verbal, and that can be cognitive behavioral therapy, dialectical behavioral therapy. Most insurances pay for therapy in this way, so certainly explore that if again, particularly in verbal individuals. Family, parent, caregiver therapy and trainings, to our point earlier. If you've got your own anxiety, depression, trauma, or you just need help and coaching on how to manage behaviors, don't be afraid to ask and get the support you need. And certainly medications are a consideration if the behaviors are dangerous or they are not improving despite all of these efforts, all of these interventions, then you really got to consider medication as well. So we've done our logs, we've had our functional behavior analysis, we've had our assessments done. And so now everybody comes together and says, okay, we've identified this, and this seems to be the culprit and why this person's having problems. So you want to change the antecedent, which means you want to change what's going on beforehand to prevent the problem behavior. So maybe that's saying we need to give them a better communication system. We need to make sure, I remember my younger son, would leave to get on the bus like at 7:30 in the morning, and then they wouldn't have lunch until noon. And he started he wasn't really aggressive, but he'd start really kind of yelling and getting really dysregulated around 10 in the morning. And we finally figured out it was because he was hungry. So we built into his IEP that he needed to have a snack break at 10 every morning, and that completely fixed the problem. So again, it just requires really thoughtful analysis, and it doesn't have to be something really, really elaborate, but prevent the problem behavior. So what do? We said, he needs to be allowed to go out of the room for 10 minutes and have a snack break, and that fixed the problem. You want to, prompt or coach desired behavior. Again, you don't do this when the person's in the middle of an upsetting behavior. That's not the teachable moment. How many of you are willing to take criticism or feedback when you're really, really mad or upset? Like 0 of us, right? So think about that. That's not the moment to teach. You have to de-escalate that in the moment. And these are things to work on when everything's calm and the person's happy and you're happy and we can have a meaningful dialogue. You want to teach the desired or alternative behavior. And you also want to change the consequences. You want to reinforce positive behavior. And of course, you've got to respond to problem behavior in an appropriate way. You hear about this concept of negative reinforcement. And so some kids are pretty clever and they understand if they don't want to be in a classroom, don't want to be doing an activity, and if they throw chairs and get up and scream and yell, they're going to be removed from the classroom and maybe be sent home. And maybe that's what they wanted. So you've got to respond to the problem behavior, but it needs to be in a way that's effective and isn't reinforcing the negative behavior. And again, that requires somebody to help us figure out a behavior plan, and everybody has to be on the same page. What to try before or with medication. So all these different kinds of behavioral interventions, again, routine visual scheduling, front loading, and social stories. Again, with my little example of the power going off, I front load that every time and say, no power off, it's not going to happen. So he doesn't get anxious and doesn't have challenges later in the day or have difficulty sleeping. Social stories are a wonderful thing where you write a story about what you want to see the person do in certain situations. So there's lots of information on the internet about all of these things. There needs to be consistency between homeschool and the therapist. So everybody needs to have a powwow and talk about, okay, this is the behavior plan. This is what we're doing. Everybody's on the same page, because if you're doing one thing as a parent, the school's doing something else, and then maybe ABA therapists are doing something else, that's not going to be successful ever. Child's just going to get missed messages and not really learn anything. Use speech therapy to improve communication. As I said, if you don't have any tools to communicate, you're eventually going to blow up. Exercise. I think it can not be overstated. Physical activity and exercise. There's lots of wonderful special needs programs. My sons to this day still go to swimming lessons weekly, and I have them as part of their day program. They also go swimming into the YMCA as part of their day program. I'm a big believer in fitness just for their overall health, but I think it also helps keep them regulated sensory-wise. So physical activity and exercise is very important, and it's easy to do. Try and establish consistent sleeping and eating routines. Always a challenge with autistic individuals, but really, really work on that. ABA can be very helpful with challenging behaviors. And CBT, cognitive behavioral therapy. There's some early research on the benefits of that for individuals on the autism spectrum, particularly individuals who have comorbid anxiety, depression, and some other things that they really need to work out. Social skills can maybe be worked on a bit in CBT as well as kids often are bullied. So I think they need a place to go and talk about that and get their feelings out. So CBT. This is a slide that just shows, for those of you familiar with communication systems, these are what we call board maker cards, and they have them for behavior about what you say you don't want. No biting, no scratching, no pushing, no hitting. So, these can be things that can be worked on in a proactive way and saying what is acceptable and what is not acceptable, but this is an illustration of that. So when do we consider medications? As I said, I'm a family nurse practitioner, and this is not a lecture on medication, but certainly medication has a role and a place in this conversation. The first thing I will say is that medications should always be used in combination with behavioral therapies and as part of a comprehensive family-centered treatment plan. Is it a lot of work to do the behavior plans and the behavioral therapies? Absolutely. But medication is not going to fix the problem, and it's often temporary. I will say to you anecdotally, over the years, I have colleagues and people that I know that started meds early on, maybe didn't do the full work with aggressive behavior management in behavioral realm, and now their kids are on like 4 medications for aggression. So you really, really need to combine, if you're going to go medication route, with other therapies and treatment. When do we consider medication? When the severe behaviors persist and we've exhausted all of these behavioral interventions. Okay, we're doing it. We're doing it every day. Everybody's on the same page. We got a good plan, and it's still challenging. Well, yeah, then you absolutely should consider medication. Understand there is no medication to treat the core symptoms of autism. The FDA-approved medications out there for autism are to treat irritability in autism, but it doesn't actually treat the core symptom or core symptoms of autism. It's just for the irritability, and that would be Abilify and risperidone. Medicine can treat, though, associated behaviors or comorbid conditions such as ADHD, depression, and anxiety. And there is really a lot of value if a psychiatrist professional sees them and said, yeah, they have autism, but they also have generalized anxiety disorder, major depression. There's a much higher risk of suicide in level 1 autistic teens and adults because they are very aware that they don't have friends, that they are struggling socially. And it is extremely important for us to address that and get the appropriate treatment, which may include medication. So certainly comorbid conditions, absolutely medication can be extremely helpful and beneficial. And know that comorbid psychiatric conditions often don't respond to behavioral therapy. So meds may be needed. To my point, depression, anxiety, often you do need to think about adding medication to help that person have a better quality of life. I want to mention right here that there are other resources in San Diego to help you. We talked about asking for help, getting help. The San Diego Regional Center has a number of services that you may or may not be aware of for those of us that have individuals with challenging behaviors. The first one is called Safety Alert, Inc. It's a 24/7 service that if your family member is having aggression, is escalating, they're rumbling, and you can see what's coming, you can call them. They have already pre-screened you. They will have your file on record, so they'll be able to pull up your situation. They will know you. So this is something you have to pre-register for. And they will talk to you and say, okay, what's going on? Okay, what are we doing here? And if need be, they'll actually send somebody out to your home to help you de-escalate the situation. You must request this from your case manager at Regional Center. And then once it's requested, they'll refer you over to Safety Alert, who will do an intake and have the information about the individual on file so that when you call them, they will know more about your situation and be helpful to you. There's a couple of intensive behavioral programs that the Regional Center will fund. The first one is called START. It's an intensive behavioral program. It is not ABA. It's specifically, START and Fred Finch wraparound are specifically designed for individuals with, I think, starting at 6 years old and up with significant severe behavioral challenges, who are at risk of out-of-home placement, who have been hospitalized, who have had to have 911 PERT called for their behaviors. So individuals who are in that realm or on the verge of being in that realm, this is what these two programs are for. You need to request these services, again, through your case manager, and they will refer you over to one of them, either START or Fred Finch wraparound. As I mentioned earlier, I did access the in-home behavioral consultation when my son was doing the pounding and then started doing the yelling and screaming. And that was maybe just like 3 years or so ago. And it was really helpful. And that's funded by Regional Center. And the person that came out and did it actually did evaluate my son in many natural domains. Came to our house, went and saw him at his day program, and actually came when he was at his swimming lessons, and to see all these different situations, and really did a nice, I thought, functional analysis of what was going on and came up with some really good recommendations. So again, to the point is, no matter how long you've been at the rodeo, don't be afraid to ask for help. There's a lot of good people out there doing a lot of good work. And ask for more respite hours. If you're really, really struggling here, you don't have to leave your house when respite comes. Some of you may not realize that. You can still be in your home, but it's nice having another person with you. Or if you're like, I can't go to Target because of my child being an eloper or taking their clothes off or getting aggressive, well, have your respite person come with you on these outings. You can do that as well. So use respite in creative ways to support what you need to do. Autism Speaks has a challenging behaviors toolkit. You can download it at their site. It's free. I think it's very useful. There's a relatively maybe 1-year-old new organization. It's National Council on Severe Autism. They have a lot of really good information, slides, videos, recommendations on aggression. Another free resource is on home strategies for meltdowns and how to develop a sensory diet for the individual, and the website is there. And for those of you who are not aware, you may be able to get in-home supportive services, which provides paid caregiving for the individual. The only prerequisite to even apply is the individual must be on Medi-Cal insurance in order to apply, but it does provide another avenue for caregiving. That's not really a behavioral strategy, but it is something to help support the entire family unit and you in dealing with all of the things that are going on. So some resources for you. So 5 things to remember when working with challenging behaviors. I think don't take it personally. It's not about you. The behaviors are challenging. The child or the person is not. De-escalate first, problem solve later. So de-escalate first was part 1 of our lecture series. Today is about problem solving. So do this in a systematic fashion and get all the resources and people on board that you need to figure it out. Sometimes we might not see it, but there's always a reason for the behavior. And have empathy. Just imagine what the person's going through. I don't think any individual with autism that's having meltdowns, aggression, behavior is really enjoying it. I think that they're communicating to all of us, I'm having a really hard time. So final comments is, remember, most behaviors occur for a reason or a cause and will improve with proper support and interventions. They do not occur randomly or in isolation. And understanding the cause or function of the behavior is the first step in developing effective prevention and intervention strategies. And we have a few minutes here at the end, so I want to thank all of you for your participation and attendance. If you would like a copy of the PowerPoint, we're happy to share it with you. The email is listed here. Just email us or you can call us, and those emails will go directly to Alyssa and I, and we can help you with that. And I will be uploading the recording of today's presentation to the Autism Society San Diego YouTube channel. Along with this, there are many other of the previous lectures we've done, so please take part in any of those that you think are helpful. And again, I'm Shirley Fett and Alyssa, and we're part of Smart Care Behavioral Health, as well as the Autism Society San Diego. And as you know, today was the week 3, Autism, Aggression, and Safety, and we have 3 more lectures every Thursday at noon for the next 3 weeks. Next week, we're going to talk about diagnosis and disclosure, if, when, and how to talk about autism with others. And then we have what is the life plan? And then we have a fun one. What are all the perks of living in San Diego? There's lots of really nice things for people with disabilities to access that you may not know about. So we're going to talk a lot about that as well. And I'm going to stop the recording, and then we can, if there's any questions, we're happy to answer those.